Our medical school is an amazing statewide asset. We're the only public medical school for the state of Minnesota. We serve all 87 counties and the people that we train. We train across not only our medical school, but we train 70% of we train 70% of pharmacists, of veterinarians, of doctors, and we are providing really anywhere you go in the state of Minnesota, ask your provider where they were trained, and the answer overwhelmingly is going to be the University of Minnesota. Our North Star for how we serve the state and make sure our commitment to the state is to make sure that we have a great medical school that can continue to serve all parts of the state and serve the people all across the state, because we know that a strong medical school is important and critical to having health for the state of Minnesota across all of our communities. And we do that in 3 different ways. Our physicians and nurses and overall our medical school provides excellent clinical care to over 1 million patients in Minnesota every year. So that's phenomenal and a really important part of health in the state. We also obviously train these physicians, so education is a part of the medical school mission. We train 70% of the healthcare providers and of physicians all across the state. No matter where you are in the state, I want you to know that your physician was likely trained at the University of Minnesota. It's important for the state for 10, 20, 40 years from now to make sure that we still have that asset strong so we can make sure we have providers all across the state. And then we have a research and discovery mission, and in that we have nationally known recruiting of physicians who are here because they want to advance medical discovery in clinical cures, in cancer trials, in how we're going to keep you healthy when you're really sick. And with that, we bring that discovery mission to patients in clinical trials across the state, and then also just to innovations all across clinics across the state. We have to have a strong medical school that is an asset for the state and continues to serve the state for the full people in the state for decades to come. And that's really our North Star. How do we make sure that we have a strong medical school that can continue to serve all of Minnesota? And that's part of our mission as a public land-grant university. When we think about academic physicians and we think about folks that run our medical school, and I was an academic physician, right? And so each of those jobs, it's really 3 things all in one body. It's the educator, it's the clinician that takes care of patients, and it's the person then who is writing grants and writing papers and advancing medical discovery. So a typical academic physician, different than someone who is doing wonderful work but focuses entirely on their job 100% of of seeing patients. An academic physician at a medical school, a typical day looks like maybe I go see patients in the clinic for several hours. During that time, I'm training medical students at the bedside with me, probably training residents maybe in a specialty at the same time. Then maybe I'll go in the afternoon and do a lecture to maybe first-year medical students on the basics of a particular medical topic, and then later on in the afternoon, I'll go to my lab, do some world-class research that maybe will find a next cure to cancer. That's all in a single day, in a single person. And that's the kind of work our amazing physicians do. And we can't separate out those. It's one person, and really important that those folks have the ability to continue to work in a healthy, strong medical school environment that can make all 3 of those thrive. And also those medical students might also be learning in the lab so that they can then go be the next generation of doing medical discovery later on, for example. So it's a unique kind of job. When people think doctor, they sometimes think just white coat, stethoscope, go see Mrs. Jones. But while they're seeing Mrs. Jones, they're thinking about how they can teach the medical student to be the future doctor for Mrs. Jones. And they're also thinking about what the medical innovation is that Mrs. Jones needs so that she can be better the next time they see her. It's a really important type of medicine and type of physician that we have practicing. Our job here at the university is to take a long-term view for the state of Minnesota. And our job as we think about the medical school is making sure that patients have good clinical care in a year or 2 from now. As we make changes in our current environment, but also as important, and maybe even more important, is making sure that Mrs. Jones also has a doctor who is well trained to see her in 10 and 15 years from now. So we are thinking at the medical school and at the university both about how we make sure we have good continuity of care this year and next year, but also how patients a generation from now have great providers to see them.